Well, good afternoon, Sonoma County, and I hope all of you are staying dry. Hey, Jeff,
Yes.
what's with this new term, atmospheric river?
I don't know. It's very dramatic though, isn't
It
it?
does sound
Yeah, it just makes it
dramatic.
sound like it's gonna be biblical. I mean, it looks like biblical proportions, right?
Right. Why would they want to listen to Dr. Tom on KSRO? Ask the expert and talking about how to look our best, to look younger by Monday, right? Let's stay young forever. All of those little monikers that we throw at you. Hi, Sonoma County and Napa County and Maui. This is Dr. Tom on Ask the Expert. And it is pouring down. We're at the end of November here in Sonoma County, and it is an atmospheric river, isn't it, Jeff?
It's coming down.
It's
Cats
coming
and
down. It's
dogs.
coming down. So I want to thank everybody for tuning in, as we always do, for coming and listening to us every Thursday from 12:30 to 1 p.m. And today I'd like to talk a little bit about, once again, going back to the California Academy of Cosmetic Surgery and talking about the annual meeting that we just had in San Diego several weeks ago. I kind of missed that dry San Diego weather since we're so wet up here in the North Bay. I did a show earlier in the month and talked about sort of the latest news, listening to some just superb young talent in the world of aesthetic medicine. And these were cosmetic dermatologists, and then the venerable Dr. Suzanne Obagi. And we talked a little bit about skincare and what she recommends for her patients. And so now what I'd like to do today is to actually talk about what my presentations were at the California Academy of Cosmetic Surgery. I presented 3 topics down there. It was an invited lecture. And in fact, I'm very honored. They actually invited me to come back and to be the chairperson for the 2025 California Academy of Cosmetic Surgery annual meeting in San Diego next October. So I want to thank all my colleagues for inviting me to be the chair. So let's get right into it here. So one of the lectures that I gave and shared with my colleagues was, I called it Eye Enhancement with Natural Biostimulator Therapy. So eye enhancements with natural biostimulator enhancement therapy. What does that mean? Well, let's go back to, first of all, what is the pain? What is the concern that patients have when they come into our office and they have certain issues that they would like to have taken care of? Okay, and for most of us, it's a social thing. We come in for a treatment because we want to be able to feel more comfortable, more confident in our social interactions. And one of the biggest concerns that our patients complain about is having what we call tired eyes. They look at themselves and they're seeing kind of a hollowing under their eyes. Maybe the brows have dropped a little bit and they don't look as bright as they may feel. And I remember when I first started working with Jeff, who is our new program director here, that was giving a talk about this. And I was talking about the concerns about the eyes and having tired eyes. And I remember how old are you, Jeff?
31.
Jeff is 31 years young. He's younger than my kids, all right? And I remember him, as I was talking about that, I was kind of smirking. I was out of the corner of my eye. I was watching him running the control panel, and he was kind of feeling under his eyes. And I'm thinking, you know, aging starts when you're about in your late 20s. What do you think? Are you
It
noticing it?
sucks. It doesn't matter how much sleep I get.
Okay, so that's from a 31-year old virile, good-looking young man here in the North Bay, and Jeff's beginning to notice sort of that aging process around the eye. So that's the pain, and that's what we're talking about today. So one of the big issues that we have when we're looking at our eyes is a hollowness that's under our eyes. And most of the time we want to present this bright-eyed look to the people that we're communicating with. And so what happens is as we age, we begin to lose some volume of fat just directly underneath our eyes. And even in our late 20s, it's become noticeable. You may not notice it right away when you're 28 years old, but you kind of get in your 30s, you're still feeling pretty good about being in your 30s. And then you kind of hit the 40s and you're beginning to notice, oh, I notice this hollowing under my eyes, and my eyes don't look as bright as they normally do. And that's due to the loss of volume under your eye. So look at that area under your eyes. We call it the I-N-F-R-A, infraorbital, the orbital meaning your eye. The infraorbital area begins to become deflated. And as it becomes deflated, think about that area as a reflection mirror, okay? For those of you who are old enough to remember when we would try to get tan, some people would hold a reflection plate underneath their face, trying to get the sun to bounce up into their face and to amplify the effects of the sun. That was before we knew about all the dangers of trying to do that particular practice. But that's what happens is that reflecting pad that's underneath our eyes with deflation begins to point downwards. And so the light, which most of it is above us, the fluorescent lights inside or the sun outside, when that light hits our face and directly under that infraorbital area, if that area is deflated, the light hits that area and it bounces down. So instead of brightening up our eyes look duller. One way that you can look at that is to look in the mirror and just look at the mirror and be very deadpan and then smile. And as you smile, you'll notice that your eyes have a sparkle to them. Even with most of us, when we smile, our eyes get a little bit squintier, okay? But even with us squinting down a little bit when we smile, as we smile, we bring our fat pad up, and what happens is that the light hits that under area of our eye, the infraorbital area, and bounces up into our eyes. Therefore, the optics are that we have brighter eyes. And that's the concept of what we're trying to enhance when you come in to see us. So we've been through sort of a litany of different type of procedures to try to enhance that area. And I've been involved with cosmetic medicine for 24 years now. Uh, a lot of different procedures, and not all of them panned out to be as good as we thought. We did use fillers, and so that would be hyaluronic acid or hyaluronic gels, such as Restylane and Juvederm, and we would inject under that area to try to give a little bit of plumpness to enhance the look of the eyes. Yes, we're making your eyes look less hollow, but we're actually making your eyes look brighter, okay? So we would use some hyaluronic acids or the fillers like Restylane and Juvederm. Now, a little bit did seem to enhance that and did seem to offer us some benefits. But what happens with everything in medicine as well as in life, we run with a little bit and then we think, oh, hey, how about a little bit more? How about a little bit more? And then we started to try to overfill this area with filler. And unfortunately, it didn't work out so great for our patients in most cases. What happened is that it would just look puffy and not very natural. And the other is that filler is a little bit firmer. Its consistency is a little bit more firm, robust, and therefore you might see a little bit of lumpiness under the eyes. And for most of us, we don't want that. So we then went on and we looked at the possibility of maybe using some natural stimulators. Biostimulators is sort of the key word nowadays. It's sort of like using the word atmospheric river when we have a storm, okay? And so we're using biostimulators to try to stimulate our own biology to build more tissue in a natural way. So we would draw off our blood and we would spin it down and we would take the serum called platelet-rich plasma, and that's in a particular spot in the test tube that's spun down in a centrifuge, and we would take that's high in platelets, and it also has growth factors and so forth, and I call it the paramedics of the body, and what that does, it helps in the healing process. So we would inject that PRP directly under the eye, and initially, because it was a little puffy, it looked great, okay. As the PRP was absorbed, we really, for the most part, lost all the volume of injecting the PRP. Now, the skin did look better, so there was benefit to it in that our skin was smoother, we had less maybe pigmentary changes, less translucency, therefore a better reflection surface to enhance our eyes, okay? But in terms of adding significant volume, I wasn't too impressed with that. So what we did then came on, and what we did is we took that PRP and we activated it, and that's called platelet-rich fibrin. Okay, so it's a little bit thicker, and we started using platelet-rich fibrin, or PRF, which is PRP on steroids, and injecting it under the eyes. Now, I do feel that the skin, once again, was enhanced and looked even better with PRF. That was number one. And number two, I could tell that there was some slight volume enhancement, VOLUME, volume enhancement, directly underneath the eye using PRF. But it was one of those things where me as a cosmetic surgeon or physician, I could detect that, but maybe not so much my patients. And so obviously that's who we want to make happy, not me. We want to make the patient happy. And so they were sort of, oh, it's okay. I see some improvement. All right. So then we took it one step further and we drew off 2 test tubes of blood off of the arm when we like going to a lab, and we would get the PRF and we would put it in a cooling system. Karina Lozano, who's our medical assistant and wasn't able to make the show today with me today, and you've seen her on KSRO Ask the Expert with me multiple times. She's a regular here, but she's the mad scientist. So she takes the one test tube, puts it in a cooling system, and it helps to keep that PRF in a nice quiet phase, if you will, before we inject it. Then she takes the other tube and she warms it up and she heats it up. And what we're doing is we're beginning to try to pull out the protein out of our own serum. So this is our own natural tissue, and that protein component is called albumin. And so then what she does is she takes the albumin from the warmed up test tube, she takes the cooled down platelet-rich fibrin, or PRF, and she mixes it for me. And then it's my turn. And then what we do is we kind of freeze up the area underneath the eye with a little bit of local anesthetic, and then I take a long tube called a cannula, which is blunt, so we get much less bruising and issues bleeding afterwards. And what I do is then I take that PRF with the protein component and I inject it directly underneath the eye. And I have to tell you that I'm very pleased with that result. Now I feel that we are establishing volume in that area directly underneath the eye, which is beneficial. We're also getting the skin enhancement with the PRF gel. This is actually called Easy PRF gel. So like something's easy PRF gel. And it's worked very nicely in terms of enhancing the under area of the eye, or the hollow under the eye. But that's kind of interesting that we started in that area, injecting directly underneath the eye with the Easy PRF gel. But to me, that's looking at maybe a broken down window frame area and just working on the just on the bottom part, the shelving of the window seal on the window. But the wall's breaking down too, that's holding the frame. So we were ignoring the structural support for that window frame. So what could we do to enhance that? Well, staying again, trying to be natural, because that seems to be where we're headed in cosmetic medicine. I think it's a wonderful way to go. Being a previous organ transplant surgeon, it's right in my wheelhouse. I love this sort of stimulating our own biology to enhance our looks. And so what we want to do is we want to add some volume directly in the cheek area, just below the infraorbital area. So we're supporting that undersurface of the eye. And what we're now using is a combination of 3 treatments. One can be Renuva, which is cadaver fat, and so it's fat that comes from a tissue bank. It is very safe, and what we do is we take that and we can inject it directly underneath the eye, and it can enhance volume immediately, which the patients, of course, love. Now, what happens is your body starts to break down that matrix of fat and begins to stimulate our own stem cells to replace that fat with our own fat. So we're actually taking our own fat and we're laying it down on this matrix of Renuva that was injected underneath the eye. And I actually really love this. And it was really nice. It was a nice compliment for me that Dr. Susanna Obagi, who I spoke about a couple of weeks ago, who is a phenomenal cosmetic dermatologist out of the University of Pittsburgh. And so she came up to me and talked to me. And it really was... it was enlightening for me, because I consider her one of the giants in the field. And I saw her taking notes, and she was taking notes during my talk, and came up and she had a little pad and she's looking at her notes and she's asking me questions, which really shows why she's such an excellent physician. Because if you want to be good, you have to always be the perpetual student. And that's something that Dr. Susanna Obagi does and leads by example. So she came up to me and talked to me about her experience with Renuva under the eyes, and asking me about how I mix it and how much volume that we inject. We had a really nice conversation. And one of the comments that she had made to me is that when she injects it under the eye, some patients complain of more discomfort than she would like. And I explained to her that from my experience doing facial fat grafting, I actually like to inject local anesthetic in the area that I'm going to inject before I do anything at all. So it basically becomes a painless procedure for our patients. And her comment to me was, so you have to kind of decide how much you're going to put in ahead of time before you inject the Renuva under the eyes. And I concurred with her conclusion. That's exactly what we do. So you want to go to someone who's experienced, and putting Renuva, or the acellular adipose tissue matrix is a fancy name, underneath the eye and the cheek area can help to enhance the eyes. And that works very, very well. Another biostimulator that we can use to enhance the cheeks as well is a treatment called Sculptra. And Sculptra is actually made out of a material that's very similar to absorbable sutures that I have been using in surgery for 44 years. Yeah, that's how long I've been doing surgery. Oh my gosh, I can't believe that. Okay. And so, excuse me, I said 44. I meant 40 years. Okay. So that's how long I've been doing surgery. And so we use absorbable sutures all the time, maybe to close up the abdomen or taking out a bad part of the intestine and bring it together. What happens with that absorbable sutures? Well, initially, because they're intact, they're holding whatever we put together, okay? Then what happens is our body begins to break down that absorbable suture. That's how it reabsorbs. And as it's doing that, it begins to lay down collagen or scar tissue in that area. That's why when we remove part of the intestine and bring it back together again, why does it stay together? It's because of the scar tissue the body has creating, the collagen that it's creating. Also, why does it, when we open up an abdomen and then we close it back up together again, why does it stay together? Again, it's because of the scar tissue, that is holding the tissue together in that area. So what they did with the makers of Sculptra is they found that the Sculptra would build its own collagen, and they started to use it to build back volume underneath the skin. We've already talked about earlier in the show how the body, the face begins to lose volume. And so when we inject Sculptra, which is it's a powdered form that we mix in sterile water, okay? And then we also add a little local anesthetic. Again, I always like to make sure my patients are very comfortable. And we can inject it in a very diffuse manner in the cheek area and sometimes in other areas, in the temple area, which helps to lift up our eyebrows and so forth. And we can use that Sculptra. And initially, because it's the sterile water, you have this really nice filling effect, and patients go, wow, I look 5-10 years younger. This looks great. I have to explain to them that water is going to reabsorb. So in a couple of days, you're going to be thinking to yourself, geez, what did Dr. Tom do to me? Because he injected it, it looked great, and now it's kind of disappeared. Well, what happens is that water is reabsorbed, but now your body begins to work on the powder, the Sculptra powder that was injected in this water vehicle. And then it begins to lay down its own collagen and begin to add volume. And you're going to begin to see that effect in about 2 to 3 months out, okay? And it does take multiple treatments, but it's a nice natural way of stimulating your own body to produce its own collagen. And so that works very, very well to, again, reestablishing a more youthful, healthy look in our face, and works very nicely in the cheek area. So that was treatment number 2 that we could do for support in the cheek area. Then we found, as we have kind of evolved over the last 2 decades in cosmetic medicine, that there is another treatment called Radius, okay? And Radius is calcium hydroxyapatite, and it also stimulates collagen. And because it stimulates collagen, it can add more volume as well. And by itself, it's a little bit more robust than the typical hyaluronic fillers like Juvederm and Restylane. So we've been looking at using Radius in a hyperdilute fashion so that we dilute it down with sterile saline. And when we do that, we're using it kind of in the face to help to support the whole structure. So we don't want to just work on one area. We want to work on the whole face globally. And we found that by adding that Radius in that area, what I call the straw sucking area. So if you look in the mirror and pretend like you're sucking on a straw, it's in that area there that can become deflated, lead to jowls. So if you start this soon enough, you can have you can maintain that youthful, healthy look for decades. And the sooner you start, the better it will be. Number one, if you're in your 30s, okay, your immune system is better. You're going to stimulate your body to create this healing process, and it's going to be better, certainly in your 40s and 50s. I know I'm in my 60s, 70s, as you start to become baby boomers, you can still get an effect, but it is more effective if you are younger. So that's a great way of enhancing the eyes with biostimulators. So in summary, just kind of talking about the eyes, one thing we want to do is we want to change the reflection angle underneath our eyes. So using easy PRF gel, which is a blood draw, 2 test tubes, taking your PRF, or the paramedics of the body's serum, platelet-rich fibrin, and mixing it with your own protein or albumin and mixing that up, we get volume, and we can inject it directly underneath the eye. And it's really nice for improving the texture of the skin, thickness of the skin, but also adding some volume. Nonetheless, remember, that's kind of the finish work. So let's not forget about the structural support. And that's where we want to make sure that we are enhancing that cheek area. So we can use filler, and filler is still great. It's a great treatment. Kind of there are trends in this cosmetic medicine, just like there is in life, okay? And so we're looking more at biostimulators, but filler still is a great way to go. Restylane and Juvederm in that cheek area to help to support the face. I still love doing it, and it's still actually my number one injectable treatment besides Botox and Dysport that I perform. But if we're looking at trying to stimulate our own biology, one of the best treatments is using cadaver fat called Renuva, and that's injecting it into an area that we want, for instance, the cheek, and then our body begins to stimulate our own stem cells to begin to lay down our own fat cells on the structural matrix that we've injected in the cheek and building up our own fat. And I actually love this treatment, especially for thin patients, okay? Maybe somebody who is just naturally genetically thin, or somebody who's, just a gym rat. They're at the gym all the time, or they eat, just twigs, okay, and they're not having jelly donuts and candy, and so they're just so thin and they burn up. They have this high metabolism, and they can sometimes metabolize filler a little bit more quickly. So I really like Renuva because Renuva stimulates their own stem cells to lay down their own fat in that area. And I have multiple patients who have found that they love this Renuva in the cheek area, which gives them a very natural feel because it's your own fat, and a very natural look. So that's putting Renuva in that cheek area. And then the second and third treatments that I discussed at the California Academy of Cosmetic Surgery meeting was using Sculptra, which is a powder which builds up our own collagen, and that works great. I have that in my face as well. I like its natural look. And then also using Radius, which is calcium hydroxyapatite, which similarly, like Sculptra, builds our own collagen, but it works on some other different types of collagen. So usually it's a combination of these treatments that can give us our best results. So if you came in and let's say you're in your 20s and 30s, you're a young person like Jeff, our program director, I might actually start you off using the Just Easy PRF gel. I may go directly to the finish work of drawing off some blood, using your own blood products to stimulate your own fat and healing of your skin, and inject that directly under that eye area. If I were to look at somebody maybe who's a little bit older, now they're beginning to get a little bit more of a sag or deflation in the cheek, then I really love Renuva, or the cadaver fat, the laboratory fat tissue, fat tissue that comes from a tissue bank, and injecting it in the cheek area. And I think that's a wonderful way of doing that. Then, depending on how much volume we've lost in our face, I would add Sculptra as my second line of defense. And then lastly, I would use Radius, which I would put in that cheek area to kind of enhance that area. So that was pretty much what I presented at the California Academy of Cosmetic Surgery. It was well received, and there were many physicians who came up to me who were just getting started in the world of biostimulator injections and were asking me questions about this. And I was explaining to them that I feel that is it's a real viable, good option for patients who want to enhance their face face naturally and to really make them look the best that they can look. And the nice thing is this can all be done under local anesthesia. You can walk out, carry on with pretty much your normal daily activities, we'll say. I'm not going to I don't want you to go to the gym that day or go out and play baseball or hockey or something like that. But really, I want you can carry on with your daily routine immediately afterwards. So it's a very, very, very nice treatment to do that. So natural biostimulating in eye enhancements would include Easy PRF gel, Renuva, which is fat from a tissue bank, Sculptra, and Radius. If you have questions about this, please feel free to call us at our office. Our consultations are complimentary. Many times we'll ask you to send in a photo so that we can actually give you a heads up as to what we might be thinking so that we can really educate you, because that's really important that you understand the treatments that you're receiving to give you the best results to look better by Monday. So I want to thank everybody once again for tuning in to us every Thursday from 12:31 on KSRL Ask the Expert. Please stay dry out there, Sonoma County.